people, namaste, welcome back to my channel. In this video, I will discuss about the another important topic from gynecology, that is PID, pelvic inflammatory disease. So, first of all, we will discuss about the pelvic inflammatory disease. This is the important university answer examination question. Pelvic inflammatory disease. Okay. So, first of all, we should know the definition. First of all, definition of pelvic inflammatory disease. What is the definition? Definition is infection of upper female genital tract. This is PID means infection of upper female genital tract. Upper female genital tract infection. Upper female genital tract means what will come? First one is uterus. Uterus, fallopian tubes. Next one is ovaries. So this is the upper genital tract. Upper female genital tract comes under uterus, ovaries, and fallopian tube. So it is the infection. Infection to the uterus is called endometritis. Endometritis. Fallopian tube is called salpingitis. Next, see friends, so uterus is the endometritis and fallopian tube. What is the infection at fallopian tube is called salpingitis. Salpingitis. At ovaries infection is called oophorytis. Okay, this is ovaries. So this is the definition. You should remember the definition. Okay, first, what is the definition? Infection of upper female genital tract. Upper female genital tract means uterus, it is endometritis. Fallopian tube is salpingitis. Ovaries means oophorytis. So this is the definition. Okay, from this definition is there. From this upper female genital tract, the infection spread to abdomen, upper parts, from the upper genital tract to upper parts. So it leads to what will happen? Peritonitis. First one is peritonitis. Next one is hepatitis. Perihepatitis, liver. It causes metastasis, like it spread to the perihepatitis and peritonitis. This is the definition of what is that? PID. PID is the upper female genital tract. In fact, upper female means uterus, fallopian tube, and ovaries. It spread to the abdomen, leads to the peritonitis and perihepatitis. Next, after definition, you should remember the most common route. What is the route? Most common route is ascending infection along with sperm. Ascending infection along with sperm. Okay. So most common route ascending infection along with sperm means STDs. So where you can see the ascending infection along with sperm is multiple sexual partners. Okay, you can see in them. So ascending infection to the with sperms. Next, risk factors. Who are the risk factors? Who are the risk factors for PID? Multiple means same. That one only. Risk factors is multiple partners. Next one is history of instrumentation. History of instrumentation. History of instrumentation, like post abortion, postpartum, all this. Post abortion, in abortion you use some instruments now. Because of that, it enters into the infection enters into the upper genital tract. Post abortion or postpartum, if any present. Next, any previous history of PID. PID history is present means this is the risk factors. If copper T, because of copper T ingestion, first 3 weeks, in first 3 weeks only, copper T ingestion in first 3 weeks, it leads to risk factors of PID. So in this phase, what I discussed is first definition. Most common spread ascending infection along with sperm. So who are the risk factors? Where we can see ascending infection along with sperm means multiple partners, history of PID, any instrumentation, and copper T ingestion is an important one. I will discuss in contraceptives also. Copper T ingestion in first 3 weeks only we can see the PID if copper T ingestion. Next, we will discuss about the pathogenesis and most common PID organism. Okay. After that route, we will discuss about the organism. Most common PID in reproductive. First one is reproductive. In reproductive women, because of chlamydia, infection because of chlamydia than gonorrhea. Most common is chlamydia only. Okay, most common is chlamydia in reproductive. Next, virgins. Invergence is because of not, because of not organism, because of TB, because of genital TB. Okay, genital TB in menopausal woman. After that, menopausal woman is due to the E. coli, because of E. coli. Menopausal woman means E. coli. Menopause means E. coli. Reproductive means chlamydia. Virgin means genital TB. Because of copper T also it is coming one of the risk factors. No, copper T, because of copper T, what will actinomycosis is present. Because of this actinomycosis, it leads to infection of upper genital tract. This is the organism. First, you shall tell about the definition. Next, most common spread and the like risk factors. What are the organisms because of this infection? Organisms are chlamydia, E. coli, genital TB, and actinomycosis. Next, we will discuss about the pathogenesis. Okay, what is pathogenesis of PID? Pathogenesis means, first what I discussed, because of to uterus, to ovaries and fallopian tubes. Now first we will discuss about the uterus. Uterus is, so uterus means what? Uterus infection to the uterus leads to endometritis. We will call it as endometritis. Okay, endometritis. So what will happen to the endometritis in uterus means menstrual irregular like clinical features, like not clinical features, what happened in this uterus menstrual abnormalities can be seen. Okay, menstrual abnormalities and pain will be present. No, pelvic inflammatory means pain, dysmenorrhea, bleeding, painful bleeding, and lower abdominal pain also. Both three are present in this uterus because of menstrual abnormalities seen, and dysmenorrhea and the lower abdominal pain is seen in uterus. Next we will discuss about the tubes means fallopian tubes, how they are present in PID: thick and congested and hyperemic and swollen tubes. They are thick, congested, hyperemic, and swollen tubes are present in these tubes. In this, because of this thick, congested, hyperemic, swollen tubes, some swollen tubes, because it leads to because of endosalpingitis. Next to pyosalpingitis and hydrosalpingitis. Pyosalpings and hydrosalpings. Pyosalpings and hydrosalpings. Next one is, after the tubes, what I discussed, ovary. Ovary means oophorytis. Because of this spread, infection leads to the abdomen. What I discussed, peritonitis and perihepatitis. Same. Peritonitis or pelvic abscess also occurs in, this is the pathogenesis. So what I discussed again I will tell. See, you can remember very easily. First, if they ask in pelvic inflammatory disease question, first you should write the definition: uterus, fallopian tube, ovary, spread. Okay, next you will write the organisms like chlamydia, E. coli, vaginal TB, virgin genital TB, actinomycosis because of copper T. Next, spread. Ascending infection along with sperm, multiple sex partners, risk factors, multiple partners, history of instrumentation, history of PID and copper T in first 3 weeks only. So, what is a pathogenesis? How we can write pathogenesis is uterus. Uterus leads to endometritis means menstrual abnormalities, dysmenorrhea, lower abdominal pain, and tubes, endosalpinx, pyosalpinx, hydrosalpinx, thick, congested, hyperemic, swollen tube, oophorytis, and peritonitis, and pelvic abscess. Okay, next we will discuss about the symptoms, complications, and criteria and investigations of PID. Okay, next we will discuss about the symptoms. What are the symptoms of PID? What are the symptoms of PID means, what before I discuss, in menstrual abnormalities, dysmenorrhea, lower abdominal pain. So first one is, they will come with lower abdominal pain. Very much pain is present. Okay, bilaterally, and dyspareunia, like increased pain during coitus. Perunia. Okay, this is the most common condition they will come with. Along with that, what I told, dysmenorrhea, before I told dysmenorrhea, uh, like like in with infertility they will also come infertility. Okay, next, in acute phases, PID, PID means inflammatory means fever is present along with AUB is present, abnormal bleeding. AUB means menorrhagia. Next, abnormal bleeding is present because of PID, menorrhagia. Next, intermenstrual bleeding, and sorry. Next, postcoital bleeding. All these are present in acute phase fever. And about the AUB, we'll discuss. See, here discuss now where menstrual abnormalities. Here menstrual abnormalities we discuss. This one we are discussing it here. Clinical feature abnormality means what? AUB means menorrhagia, intermenstrual bleeding, postcoital bleeding, and fever is present in acute phase. Along with this, dysmenorrhea and infertility also present, and vaginal discharge is also present. Okay, all this can see in the clinical features of PID. Okay, next, what are the complications of complications? Because it metastasis to liver, no perihepatitis. So what will happen? It called as Fish Hugh Curtis syndrome. Fish Hugh Curtis syndrome. What is it? Fish Hugh Hugh Fish Hugh Curtis syndrome. What is this means? Well, this complication is violent sting appearance. Which sting? Violent sting. Violent sting appearance is seen. Violent sting appearance between liver capsule, and the anterior anterior abdominal wall and liver capsule we can see as the violent string appearance. It is called face hug cutie syndrome. Okay, write the complication and leave it. Next comes to the criteria. It is called CDC criteria. CDC criteria. What is their minimal criteria, additional criteria, lab diagnosis criteria? Based on first, we will discuss about the minimal criteria. Minimal criteria means first clinical feature is coming with lower abdominal pain. No, so along with lower abdominal pain there is anything, any plus anything more. Next or what with tenderness, like movement tenderness cervical movement tenderness, and adnexal tenderness, and uterine tenderness uterine tenderness, adnexal tenderness, and cervical tenderness. All these are presented along with lower abdominal pain. Any one of them, it comes under the minimal criteria for PID diagnosis. Next, along with this, I discussed in fever. Fever, no temperature is greater than 101. I discussed in clinical features like vaginal discharge, abdominal, cervical, all this. So, in this clinical feature, like criteria, vaginal discharge should be there, and saline microscopy of vaginal discharge. This this discharge undergoes saline microscopy. When we see this under saline microscopy, there are WBC, inflammatory, no, WBC cells are increased. And comes to the lab diagnosis. In lab diagnosis, there is increased inflammatory SR and CRP. SR CRP increased, WBC increased, vaginal discharge temperature, along with lower abdominal pain. There is three. That one is cervical tenderness, or adnexal tenderness, or uterine tenderness. Any one of them will present. This is the minimal criteria. This is the lab criteria. These are the additional criteria: fever and vaginal discharge. Having under the saline microscopy, we can see is WBC increased. So this is the what is that? This is the criteria of PID. Next comes to the investigations. Investigations of definitive diagnosis. How can we see the PID investigations? PID means first one ultrasound. Okay. Next endometrial biopsy. Next laparoscopy is the gold standard. We will discuss one of them one by one. First ultrasound. Ultrasound. First one is ultrasound. Ultrasound means how we can see tubes and ovaries masses and swollen tubes. Under ultrasound, tubo ovarian mass and swollen tubes. Tubo-ovarian mass and the swollen tubes can be seen under the ultrasound. So, this ultrasound has some signs. What are the signs? You can remember three of them. See, first one is waist sign. Next one is beads on string sign. Waist sign, beads on string sign. That is violent string. This is beads on string sign. Next, cogwheel sign. Same, this beads on strings and also seen in TB also. So in beads on strings and seen in both PID and the TB. You can remember like waist sign, bead on strings and cogwheel sign. This is important. Ultrasound, tubo-ovarian mass, and swollen tubes. What are the signs? You should write the signs like waist sign, bead on string, cogwheel sign. Next one is endometrial biopsy. After ultrasound, endometrial biopsy. Endometrial biopsy. So you can check the endometritis, uterus. Uterus, you can see endometrial biopsy. In next last one is laparoscopy. This is very important. This is the gold standard. This is gold standard. Laparoscopy is gold standard. So what we see in laparoscopy, tubes, adnexa, uterus directly. You can see laparoscopy, visualization of directly uterus not uterus, and tubes and adnexa. All we can see the visualization. Next, specimen collection. We can laparoscopy. We can take the biopsy now by using laparoscopy. When we see, take the biopsy, and uh, this laparoscopy rule out this ectopic pregnancy and appendicitis. Ectopic pregnancy and appendicitis. Next, these are the investigations. First one is ultrasound, next one is endometrial biopsy, next one is laparoscopy. Is gold standard. Directly visualize. We can take the collection to rule out the ectopic pregnancy and the appendicitis. Next, we will discuss about the management. What is management? Like first OPD basis we will discuss. After that syndromic approach we will discuss. OPD basis, when the patient came with OPD basis, so broad spectrum antibiotics. Like first one is injection. Injection ceftriaxone. Injection ceftriaxone. How much? 250 mg. 250 mg intramuscular single dose. Only one dose intramuscular 250 mg ceftriaxone plus metronidazole plus a tablet doxycycline. Tablet doxycycline, how much mg? 100 mg. 100 mg BD two times into 14 days. We will treat for 14 days. Along with tablet doxycycline, we can give metronidazole tablet also. Tablet metronidazole. How much mg? 400 mg. 400 mg BD for 14 days. BD for 14 days. This is 100 mg, this is 400 mg, this is 250 mg. This is the injection. No, this is 500. This is 100, this is 1. These are the tablets for 14 days. Okay. This is the OPD basis treatment. Okay. When giving the OPD basis treatment, so you will advise some precautions and indications. For first precautions, first advices, what are the advices you should give to them? What are the advices? First, abstinence for while giving 14 days. No, we should abstain for 14 days. Next, along with the hair treatment, partner treatment also required. Along with barrier contraceptive, you can use barrier contraceptives. Avoid alcohol because you are giving metronidazole. No, because of metronidazole, alcohol should not be taken. So metronidazole, alcohol should not be. Barrier method partner treatment, abstinences for 14 days. If you give an OPD basis, these are the ceftriaxone, metronidazole, doxycycline are given as 14 days, and I tell the prevention. But they indications for admission for hospital. What are the indications to it is urgent for to hospital? What are the indications? When we are giving this oral treatment, not responding to oral not responding to oral treatment. Again, pelvic abscess is occurring. Pelvic abscess. And pregnant female with clinical severe disease and pregnant female unable to take, like pregnant female unable to take this oral drugs, or like severe disease. Pregnant female with severe disease, we can take the admission. Along with admission, so we can take admission and treat them. Okay. Next, we will tell about the syndromic approach also. So who are having the admission because of pregnancy, severe disease, and any pelvic abscess not resolving by, so of this indications treatment, IV antibiotics, same IV antibiotics is there. No, continued for 24 hours. After up to ephemeral, up to ephemeral means fever decreased. After fever decreased, along with oral antibiotics also given. Oral antibiotics for 14 days. This is the treatment for the after admissioning to decrease this serious conditions. 24 hours oral antibiotics, after the 14 days oral antibiotics. Next, syndromic approach. Syndromic approach, how we given syndromic approach means indications. Before giving syndromic approach, what are the indications means, before I told, no, lower abdominal pain along with like uterine tenderness, adnexal tenderness. Next, cervical motion tenderness. All these tendernesses, any one of the tenderness I discussed in CDC criteria. If there any criteria is present, like UPT is negative, any these all these present, then we can give gray kit and yellow kit. For a patient, yellow kit. For partner, gray kit. Gray kit for partner. For patient, yellow kit. What same cefixamine. Before that, ceftriaxone IV I told. Ceftriaxone IV, but here tablet cefixamine. Tab cefixamine, that here two, there 250 IV, here 500 mg. Tab cefixamine along with metronidazole, along with doxycycline, Before doxycycline, how much? 100 mg. BD for 14 days. I discussed. No, same. You should write here. Metronidazole 500 mg. Sorry, 400 mg. What I discussed, 400 mg. No, both 400 mg. Here also 400. Cefixamine also 400 mg. BD for 14 days. Okay, this is the yellow kit. How we can treat the partner? Same tablet, cefixamine. Same tablet, cefixamine 400 mg, single dose. Along with this, here azithromycin can be given. Azithromycin 1 gram. Azithromycin 1 gram can be given. For the syndromic approach, indications. What are the indications? What are the treatment? I'll also give advice also. Like same what advice given in OPD basis, abstinences for 14 days along with use of condoms, like barrier methods you should use, no partner treatment, avoid alcohol, all this same you can write here also. So this is the PID, pelvic inflammatory disease. I will discuss this PID in a simple manner so you can remember easily. First, what I discussed, first you should write the definition. Like what is the definition? Infection of upper genital tract. Upper genital tract means uterus, ovaries or fallopian tube. Uterus is called endometrius, ovaries is called oophorytis, and tube is called salpingitis. Along with it, spread of infection to the abdominal organs, like what it leads to peritonitis and perihepatitis. Next, what are the organisms which causes infection? Means chlamydia. First one is chlamydia and referred to as postmenopausal and E. coli, and virgins it is genital TB, and copper T is the most common cause of actinomycosis. These are the organisms. So how they can spread? Means ascending route along with sperms. They can spread because what are the risk factors? Means multiple partners, history of instrumentation. Next, already history of PID and copper T. In first 3 weeks in copper T injection, it leads to PID. Some people it leads to PID. So what are the pathogens? After that, first I discussed the definition. Next, you should write the organism. What are the organisms causes? Next, what is how it root and risk factors. Along with that, pathogenesis. You can remember pathogenesis. What is the pathogenesis? Pathogenesis due to uterus, tubes, and euphoritis and peritonitis and pelvic abscess. Uterus means endometritis. Endometritis means three features: endometrial, uterine abnormalities. Uterine abnormalities and clinical features. You should write abnormalities means AUB. It will come AUB, and dysmenorrhea along with lower abdominal pain. After that, tubes. Tubes are thick, congested, hyperemic, swollen tubes. So it is called endosalpingitis, euphoritis, hydrosalpingitis. Next one is pyosalpinx, endosalpinx, hydrosalpinx. Here euphoritis and pelvic abscess and peritonitis comes under the pathogenesis. So after the pathogenesis, what we write? Clinical features. Clinical features means what? Lower abdominal pain is the most common. So most common is lower abdominal pain and dyspareunia. Along with that, in acute phase, pelvic inflammatory, no fever. They come with fever along with before I told menstrual abnormalities means AUB. AUB is called menorrhagia, intermenstrual bleeding, and postcoital bleeding. Along with I told about dysmenorrhea. So along with infertility and vaginal discharge is present. So what are the complications? Like Fitch-Hugh cutis syndrome. It is the violent string appearance between the liver capsule and the lower anterior abdominal wall. Next, another criteria present like CDC criteria. First criteria is they should have lower abdominal pain. Along with that, based on this criteria only, we are giving syndromic approach also. Along with that, we can have cervical motion tenderness or adnexal cell tenderness. Along with that, or any uterine tenderness. Any of the three of them, along with lower abdominal, comes under this criteria. Along with additional criteria, fever. Fever is 101 degrees Fahrenheit. Along with vaginal discharge. In this discharge, when we see the under microscopy, there are more WBC present. Along with the lab criteria, the ESR and CRB. After that criteria, we discussed about the investigations. What are the investigations? First ultrasound. Next one is endometrial biopsy. Next is laparoscopy. Laparoscopy is a gold standard. So ultrasound. Like we have tube ovarian masses, any swollen tubes. So these signs are important in ultrasound. That is waist sign, like cogwheel sign. Next, beads on string appearance. This seen in both the TB also in genital TB. We can discuss, and that also we are using the word like beads on string appearance, and in PID also beads on sting appearance. So these three you can write in ultrasound. Next one is endometrial biopsy. Next one is laparoscopy. In laparoscopy, gold standard visualization of uterus, tubes, adnexa we can see, and specimen collection also see. But no, in laparoscopy helpful for rule out the any appendicitis and any ectopic pregnancy. So directly we can go for the management in OPD basis. We can discuss about the injection. What is that? Directly we can the injection ceftriaxone. How much? 250 mg. Next, one single dose. Next, doxycycline, metronidazole. Doxycycline 100 mg. Here 400 mg. BD into 14 days. So advise them like abstinences for 14 days or partner treatment, and metronidazole is taking no, so you cannot avoid alcohol, and barrier contraceptives can be taken and indicate. Next next after OPD, then if some patients are more if not responding to these oral drugs, then we should for admission in hospital, so who are not responding, who are pregnant female with severe disease, already pelvic abscess present, indication of for them directly give IV antibiotics up to continue for 24 hours, like efabril continue for efabril till 24 hours, next along with oral antibiotics for 14 days. Next we can come under syndromic approach of PID. Syndromic approach, what are the indications? Before I told, no, lower CTC criteria, first criteria, minimal criteria, what is that? Lower abdominal pain along with uterine tenderness, next tenderness, what this uterine tenderness, adnexal tenderness, cervical motion tenderness. So if any of them, next syndromic could do syndromic approach like yellow kit and gray kit. Gray kit is for partners, yellow kit for patient. Like here tab cefixamine is 400 mg, same metronidazole also 400 mg BD for 14 days. Next doxycycline for 100 mg 14 days. Gray kit same cefixamine 400 mg 400 mg for single dose. Here azithromycin for partner 1 gram 1 gram. What is advice? Same advice, abstinence for 14 days and use the barrier contraceptive like condoms can be used. So this is the PID question, very very important for university exam. Please subscribe my channel, please support us. Thank you.